So scoliosis affects 1 in 3 adolescent children in the world. I want to present to you a case study that shows the improvement of a 13-year-old who was diagnosed with adolescent idiopathic scoliosis, and what a tremendous improvement we saw in her posture and also the structural deformity. And there are two strategies that we use to do it, knowing that not all braces are created equal and not all care is equal and can be very different for each individual person. So this was our case study that we presented in Dallas at the chiropractic biophysics seminar. And it was an improvement in the adolescent thoracic scoliosis using scolibrace and chiropractic biophysics rehabilitation. So she was, just a summary of it, she was 13 years old, female, diagnosed in a local hospital in 2019. She was using a Chanel brace where the mother was not happy with just how she looked in the brace itself. She did have a Cobb angle of 37 degrees to the left in the thoracolumbar and her right 17 degrees. Her growth plate or her Risser signs were not reported in the report that we had received. And when I show you the x-rays, you'll see this large coronal imbalance from the midline, which really makes her look asymmetrical. And we had a significant improvement in that. Multiple postural abnormalities were found during the assessment. The sacrum, the base that holds the spine, was also tilted, or as well as she had a left leg inequality. She had no back pain, which is very common to see in a lot of the adolescent scoliosis cases. Um, they're more concerned with the progression of the curvature as well as the deformity it creates for these kids. So we had used a special type of overcorrection 3-dimensional scolibrace, and she had received that in 2020 of March. Wore it for full time, around 20 hours per day, and we had monitored her for every 3 to 6 months. We reassessed her for over the next 2-year period. And you'll see the improvements that we've made in her balance, in her shoulder blade symmetry. We also added something called chiropractic biophysics rehabilitative care using mirror image adjustments, a scoliroll, and I'll show you what that looks like. We also applied some mirror image tractioning, also at once a week, and then we moved into twice a month for about a year. She had around 45 sessions. We also added a 10-millimeter foot lift on her left side to try to create some balance in the base of her sacrum, which you'll see better from the images that we'll show you. So here is a picture on the left that shows the scoliosis. There we go. Make it a bit bigger for you. So there it is on the left. You can see the midline at the green line. There's a large shift to her left, which we call a coronal imbalance. She had really yet to get into her growth. She's a Risser 0, so lots of growth left to happen. So there is a concern for progression and deformity. And this is what she looked like on the left, on her own, with her own posture. You can see the tilting of her shoulders. And she's bent to the left-hand side. And this is the brace they made from the Chanel brace at the hospital. And you can see what it looks like. It actually makes her shoulders look worse than what she is on the left-hand side. So it's not making it a correction. With braces, we do want to see that the brace is actually creating a correction. We can easily see that this brace may not be doing that, as it's allowing her left shoulders and the spine to bend to her left. So it actually makes it worse. And that's what her mother had seen. So we did the Ford Adams bending test. In this picture, we actually had a small lift because we did see that using a tool we call a scoliometer, that when she bent forward, she had a rib humping on her left-hand side, but we added a small lift, which reduced it down from 13 degrees, I believe, to 5 degrees. All right. Now, this is her pelvis using a special view called the modified Ferguson. You can see that her sacrum on the left side there where the line is 27 millimeters drop. Her femur heads were 9, so they weren't, usually sometimes we see them as the same measurement. These were different. So we did some special calculations and we figured out the size of her lift that she requires. Not all cases have this, but I would say a good part of them have some kind of part with their sacrum. And sometimes we have to give them a lift, a foot lift inside. And really, I think the maximum tolerance people can handle in the shoe is about 10 millimeters. So we ended up going with 10 millimeters in her lift to help her balance her leg length and try to reduce the distortion of her sacrum. So this is the scolibrace on the right. You can see that the shoulders are much, much more level because the way the brace is designed to put this patient in a mirror image overcorrected position. So shoulders are level, and then you can see the push on the left-hand side to reduce the deformity down in the thoracolumbar area. There's the front view. You can see how these scoli braces are made. They're easy to put on, easy to take off. The Velcros into the front. There's a buckle there for the guide. So this was some of the what we call the mirror image exercises and some of the challenges that we had to try to do. And we had to use what we call a big word of the non-cumulative properties of finite rotation angles under addition. Very complex term and principles designed to mirror image the distortion and the structural deformity to more into a corrected position using her muscles. And then we used a special instrument called an impulse, where we stimulated these little receptors in the sacrum and the thoracolumbar junction to stimulate her muscles and sensors to readapt and help her body kind of strengthen into a corrected position. So here she is here in the neutral on the left, doing the mirror image exercise, and then standing with it. And then we put her through different challenging exercises to try to throw her off, like for core stability wise. Here's the traction that we did to try to bring deformity down, hopefully in the same order that we had done with the exercises to allow ligament creep to occur to stimulate further corrective change. This is called a scoli roll. We had her lying on that for about 15 minutes, and we had her do some core challenging exercise with her leg and hip rotation exercises, as you can see here. So you can just see the progression from February when we saw 2020 on the left, and this is about June. Now, you can still see the distortion. This is where she was still using the brace, but with the added rehabilitative care that we did with the mirror image exercise and traction, you can see by July of 2023, you can see really some good symmetry of her posture, shoulders, shoulder blades, and she looks a lot more symmetrical after we added the corrective biophysics care in the latter half of the year there. And that was her outcome. And again, you can see it a lot closer from the back. So 3 years ago on the left, her shoulders are tilted significantly. And you can see now the end result is a very symmetrical looking spine. We'd never even know that she has a scoliosis here on the right-hand side. So here is her x-ray measurement. And so she had a 36-degree deformity on the left. And then 3 years into it, she drops down by about to 25 degrees. So a 10-degree correction. And you can see the balance. She was a 62 millimeters from the central axis line, and she came into more balance at 20 millimeters. So about a significant 4 centimeter improvement in balance. And that becomes very important as someone gets older because the loading on the spine and the joints are more symmetrical and not so much distorted, causing higher risk of advanced disc degeneration. So here's the overall progression from the initial on the far left. You can see, again, significant shift to her left with those measurements there. This was the reevaluation 2 years later. The numbers had dropped. And this is the final at 3 years where her T1 and S1 are basically perfectly aligned. And we still had that small shift at the T12 at 20 millimeters, where she was initially at almost 60. So there's a significant improvement in balance. Her shoulder symmetry was much, much better. And now she's done through the growth. She's now finished using her brace. And we just encourage some continuous mirror image exercises with her and to see the significant progress of what really can be done with adolescent idiopathic scoliosis using a overcorrective brace, scolibrace, and chiropractic biophysics rehabilitative care and monitoring closely and to really get a really good outcome for this young lady and reducing her risk of developing future problems as she got older. So this was a significant outcome. I just wanted to share that with you because again, not all braces are created equal. Some make it worse and don't do anything. But we had a really good success, and we still continue to see that with various scolibrace users and adolescents, which we also can use for a lot more pain control for advanced deformities in adults as well with good outcomes. So I hope you found that helpful and to give you another option for parents looking for better solutions to their children's scoliosis. And I'm Dr. Kahlid Mankal from Ottawa, Ontario, Canada. And if you have any questions, you can leave them below in the comments, and I'll reach out to you to respond to you or find you a scolibrace provider near you. Hope you found that helpful. Bye for now.